My name is Morten Fjalland, and I will be the moderator of today's inauguration session, focusing on a European perspective on the transformation of healthcare enabled by digital. I'm honored to introduce the opening video message from Thierry Breton, the Commissioner for Internal Market, who will present you more about Connect University, the digital health initiative, together with an overview of the Commission's efforts in this field. Commissioner Thierry Breton.
Dedicated to digital health. The Connect University is a powerful learning initiative, promoting networking and knowledge dissemination. Since 2015, when the first edition was organized, Connect University has developed into a huge success, shaped by inspiring thinkers coming together to spread impactful ideas, empowering us all to shape a digital society. I believe there is a lot of knowledge and competence in DigiConnect and overall in the European Commission on the topic of digital health, and it is most welcome to broaden this initiative to collaborate with experts in the European Parliament, the European External Action Service, academia, and industry. With leading expert speakers from all over the world, 900 participants from the EU institutions and 1,600 participants from industry and academia registered to the sessions, I believe this is one of the most important and top-class learning events organized by the Commission. The focus of the 2020 edition of the Connect Universities on Digital Health is most timely. During the past months, the coronavirus pandemic has severely affected our economy and society, seriously impacted the functioning of the single market, and disrupted international supply chains and people's freedom of movement. The coronavirus pandemic also shown us that digital technologies can be key component to respond to the crisis, including, of course, in the healthcare sector. Data and digital technologies, such as artificial intelligence, high-performance computing, robotics and mobile solutions have the potential to address the huge pressure felt on healthcare services in the EU and to find new healthcare solutions. For example, EU-funded research and innovation projects like Escalate for Cove, which brings together the most powerful supercomputers in Europe, has already delivered promising results in our understanding of the virus and potential medical solutions. Artificial intelligence and machine learning can support diagnosis, the organization of clinical workflow, or resource allocation in the hospital. Telemedicine platform could spread the use of remote consultations monitoring and observation of patients. Finally, let's not forget the power of mobile health, which has been also shown on the example of contact tracing apps launched recently. In summary, the coronavirus pandemic has highlighted the potential of digital health in the response to the crisis. The EU should act strategically and create the conditions for researchers, industry, healthcare systems, and patients to benefit fully from this potential. In this sense, the Commission focuses on 4 particular objectives with regards to the digital transformation of healthcare. Firstly, we need to improve citizens' and patient access to their health data. Secondly, we want to solve the sharing of data for research purposes. Thirdly, we want to see good uptake of digital innovations in healthcare systems. And finally, we need to support European industry in this domain. We have several initiatives ongoing in these areas. For example, the European Electronic Health Records or the health data space. In order to fully leverage the power of data, establishing common standards and strong digital infrastructures for exchanging health data is crucial. In this direction, the Commission supports the initiative by a number of member states to link genomic databases across borders. Finally, we are also looking into how to win the citizens' trust for these new technologies or the opportunities of blockchain for healthcare. In the next few days, you will hear about all these topics in detail. It is in this framework that I welcome this edition of the Connect University Autumn School 2020 on digital health. Thank you, and I wish you all a successful and fruitful opportunity to learn and discover more over the next few days.
We thank very much our Commissioner Thierry Breton for his speech. We are very honored to have him opening this event today and supporting the Connect University project that now reached its fifth year this year. To date, Connect University has organized some 3,000 inspirational sessions. We've had 4 summer schools on latest technologies with more than 8,500 attendees and over 30,000 online viewers. This year, COVID-19 obliges, we have moved the summer school to the autumn, and it is an all digital event. So thank you very much to all those tuning in from where you are, and whether you are academia or industry or other stakeholders, you are very, very welcome to this session. The Connect University session does intend to bring together disruptors from the world of technology who come to discuss the future of digital. It represents an environment that should enable synergies between the various EU institutions, industry, academia, and we aim to raise awareness about the ongoing digital revolution, preparing the society for the future changes, and also hopefully inspiring thinkers and decision makers here. The Connect University sessions often feature eminent international speakers, sometimes even Nobel Prize laureates, discussing about topics placed high on the political agenda, such as artificial intelligence, online disinformation, cybersecurity, advances in medical research, digital for sustainability, blockchain, 5G, to name some of the sessions and topics that we have dealt with previously. We are very pleased to see so many of you registered this year. Thank you very much for this. You're coming from all over the world, Europe mainly, but also in other regions across the world. We are even more delighted to announce that in order to recognize the investment made by participants in attending the events, diplomas will be given if more than 7 sessions are being followed. At the very end of today's session, we will let you know of all the other sessions that comes after the opening session today. There's a total of 11 sessions over the next some 2 weeks. I will also in a moment give you the links to where you can see this information, including also the hashtags that works on Twitter for today's session. That will come on screen in a moment. So the topics in the rich program of this Connect University Autumn School 2020 reflect and provide further insights in the implementation of our technologies and of our policies that have been mostly developed by DG Connect and other Commission colleagues under the umbrella of the Digital Single Market, and now also as part of the Commission's drive on digital transformation. In addition, the Connect University Autumn School program provides a broader insight in digital health, well beyond the current pandemic, covering the technical research, policy, and societal aspects of digital health, including across several areas of disease, like cancer and neurological diseases. You will now have on the screen the main Twitter handle that can be used for this session today, but also the next sessions over the next 2 weeks. So do feel more than welcome to activate yourselves on Twitter and get connected also in that way. I think the program this autumn school touches upon some of the key matters that we are facing in the field of digital health, mainly and including the impact of artificial intelligence on the future of healthcare, the way that supercomputers could be used to address complex issues in health research, how big data is positively influencing patient care outcomes by using models of personalized medicine through the analysis of large data sets. These are also some of the things that our Director General, Roberto Viola, will come in and discuss more in a moment. The contact tracing apps, their benefits in limiting the spread of coronavirus, together with the interoperability solution for mobile tracing and warning apps that member states agreed on, will be another area that we will touch upon in a moment. The contribution that fact-checking, research and media literacy initiatives can provide to support an evidence-based and future-oriented policy to counter disinformation in the EU, especially with the COVID-19 pandemic being accompanied by an overflow of information about the virus, often false or inaccurate, is another key topic. Another topic is also the efforts done on strengthening cybersecurity in health and the way blockchain could transform healthcare, enabling key stakeholders such as doctors, pharmacists, clinical researchers to gain secure and faster access to electronic medical information. I would like to thank all experts, all invited experts from across the globe who will give us top-class learning opportunity over the next 2 weeks as part of the Connect University Autumn School. They will help us getting cutting-edge insights on this digital health topic. Now, today's session will focus on the Commission's efforts to provide its citizens access to safe and top-quality digital services in health and care. We encourage you to use the Slido for comments and questions with the code CU Digital Health. So use Slido with the code CU Digital Health. Also, please use the hashtag Connect University when sharing insights on the event on social media. We invite you also to check the full autumn school program on the Connect University Futurium space or on the digital single market page. You can find the links published either on Slido or on the screen here. And you can still register for the next sessions. There's a total of 11 sessions over the next 2 weeks. But now back to today's session, the opening session for the Connect University Autumn School 2020. I'm delighted to continue this session today by introducing Roberto Viola, the Director General of DG Connect, who will offer us a comprehensive presentation on the transformation of healthcare enabled by digital. Roberto, over to you, please.
Thank you very much, Morgan. Good morning, everyone. Good morning to everybody, wherever you are and however you are connecting. It's really a pleasure to be part of the opening session of this Connect University new adventure in digital health. As Commissioner said, we have started Connect University as a bit of a travel to unknown, and the unknown was understanding better what's around us and understanding how the world is transforming and what are the forces, the technologies, the idea shaping the world of the future. And I'm really grateful to my colleagues that have joined up of forces for many years to make this possible. We started as an internal exercise in the Commission and progressively expanded to a full program that can be followed everywhere in the world online. And in particular, I'd like to thank our Dean, Florin Lupescu, which has been energetic and really determined to make the Open University a success. Today's topic, of course, in a way comes with no wonder to you why we have selected this topic today. It's central to our everyday life, the fact to consult data, to understand what's going on around us in this pandemic, and I mean, to regularly check ourselves, I mean, in terms of health status, and to check the others and to understand. So, in a way, every day we are performing a kind of digital health transaction in our society. But what is digital health and why digital health is so important? Well, I would say, first of all, health is health. And this is why this session today is organized together with our colleagues of the DG, which is responsible for healthcare policies in the Union, which is DG SANTE. And my colleague Claire Bourry will address to you just after my speech. And so I don't think in the modern times we can make really a distinction between health and digital health. To have a healthcare, to cure somebody, you need data. Without data, medicine doesn't go very far. To understand if a cure works, you need to know about the patients. You need to perform statistical checking. You need to connect different research groups. You need to analyze the results. You need to predict. So these are all data transactions. And if you want to do it looking at millions of data records, then you need something very powerful, which is very high computer processing power, large databases, and intelligent crawling into this data. Well, this is called artificial intelligence. So many things are really joining up into a kind of a 360-degree toolbox that doctors, healthcare professionals should have available and have available. But of course, all of us have a little bit, frankly, a sense of frustration these days. So why we have advanced so much when it comes to data, use of data, transmission of data, but at the same time, we are seemingly not advancing very much in the fight to coronavirus. Well, of course, we have in front of us an enemy which is very complicated. It's an enemy that is invisible. It's an enemy that changes. It's an enemy that uses different tactics to attack us. So maybe it's fair to say that this is a challenge that we were not prepared to face. Maybe it's fair to say that in the past, we thought that we were masters of digital, that in the past we thought that we had a lot to give when it comes to digital technologies, but most of it so far is commercial technology. Technologies that allow us to surf on the internet, to buy things, to understand, what is going on around us, but not really technology which is up to the challenge that we have today and we might have in the future. So I think the first message I want to convey is that if health medicine is digital and digital is health and medicine, we need to invest much more in those technologies. And to do it, we need, of course, to start from the problem, to start with the medical professionals, with the communities that are using healthcare. We should not impose solutions, but we should help. If I take, for instance, the use of artificial intelligence to detect early signs of pneumonia for patients affected by COVID-19, we have been helping hospitals around Europe with artificial intelligence solutions. But of course, the technology cannot work and does not work if it is not integrated in the full cycle of handling corona patients. And I think our experience showed that artificial intelligence is very effective in the triage of patients, which maybe are not yet tested positive, but they start to develop signs, or to false negatives, which are some percent of the test. So it is not one technique, but it's the combination of many techniques that makes the use of artificial intelligence effective these days in the COVID care units in hospitals. But of course, there's again no technology which is usable if it cannot be used by healthcare professionals. We are, for instance, trying out robotic solutions to help in automating the testing, to help in cleaning hospitals and intensive care units. And believe me, the most important challenge is today to make sure that those new technologies can be integrated, and they are a help of healthcare professionals. They do not actually are an obstacle to their work. Then there's another aspect of this crisis, which is known to all of you, which is to use data to understand whether we have improvements in the way we handle, for instance, measures which have been very strict about confinement. Now, right now in Europe, they are less strict. And we need to establish, of course, a correlation between mobility of persons and actually the spreading of the infection. And during the crisis, we were able to do so. And this is thanks to mobility data. Of course, here there's a fine balance between what you can do in terms of using this data and what you must do, which is respecting the privacy of everyone. And I think we managed so far to maintain the two things in equilibrium by making sure that, for instance, to understand mobility, we always use anonymized data, aggregated data, which are absolutely good enough to understand the mobility pattern of population and to correlate it with the spread of virus. And we have been, through our Joint Research Center, you might have seen what the Joint Research Center has published in cooperation with our European Disease Control Agency, in cooperation with all our colleagues of the European Commission, in particular with the colleagues of DG SANTE, we have been able to track the evolution of the pandemic. We have been able to understand more what social distancing can bring to us and wearing of protective equipment can bring to us. And of course, I mean, we have learned much better how to manage things, and we have learned how to now face this possible second wave that is in front of us. Part of the preventive toolkit, it's also what is being known as contact exposure application or tracing application, all those applications which are using Bluetooth technology to make sure that you can get an alert if you are being exposed to someone which has contracted COVID-19. Now, much has been said on this application, and of course, they are not a wonder system, neither a miraculous breakthrough, this to be clear, but they are extremely useful. Much has been written whether as an application they should be downloaded by X million, X percent of the population, whether it's effective, the system, only if, you have a very, very large number. Well, actually, they are what they are. So they warn people about exposure. So, frankly, there's no magic number. Of course, if you want avalanche effect in terms of a very large scale of the population, you need significant downloads, over 20%. But already, the level of downloads reached in Germany, if the pace of downloading continues, and for instance, in other countries such as Italy, this continues, the results can be very, very, very encouraging in terms of helping us to cope with this. I think downloading such an app, if you have a smartphone, is a gesture of solidarity, is a gesture of love to the people that are around you, because it allows our community to cope better with understanding how the pandemic spreads, and of course to warn individuals. In this respect, we have been doing our share in the European Commission, and we are hosting the gateway that allows to interconnect all the national apps. And I must thank very much all the member states and all the experts that have cooperated with us in the last 3 months that made possible that today there's a working gateway which is about to be rolled out now in terms of the operational system being up in the air and functioning very, very soon. There are other things, and the Commissioner just mentioned supercomputing and the supercomputing platform we are using to understand whether there are medicaments, there are antivirals that can be repurposed for fighting corona, and in support of understanding the structure of the virus, and in support of understanding whatever we need to know about the effectiveness of vaccines. So there are many, many projects around the world around supercomputing, and we are happy that many are joining forces. We have an ongoing cooperation with the Department of Energy in the US to make sure that the European and US computing platforms are actually delivering results, and we are able to exchange results. We have started an advanced discussion with Korea to make sure that their computing systems and our computing system can deliver. So it's really a world alliance of scientists, data scientists, computers, to make sure that we are stronger in this fight. And when then we come to the lesson learned in the future, I think, as I said at the very beginning of my talk, we need to invest more. This is something that our President in the State of the Union last week said very clearly to Europe and to the world. We need a much better healthcare system. We need to make sure that our healthcare system can cope with the challenges of the future. It is more equal, it is more accessible, and I'm sure my colleague Claire Bourri will expand on this, so I refrain from, let's say, going too much in detail on the structural issues, but when it comes to the tools, for sure, things like data, artificial intelligence, computing, very high-speed connectivity are important. And that's why our President announced last week that 20% of the resources that we are lining up in Europe to recover from the crisis, the recovery fund, will be dedicated to issues which are related with the digital transformation of our society and the economy. The recovery fund is an impressive effort by Europe and its member states to get Europe back in course, and to do so, greening, digital transformation are essential elements. And in this, there's no healthcare reform, there's no healthcare structural change without a pinch of digitization. Well, actually, not too salty, but without salt, it will not be tasty. It will be not tasty for citizens that they need, that in the future, if we have a pandemic like this, we can be much quicker to react. And that brings me to two final considerations. The first one, it's on our flagship project, which is to make sure that we have a digital companion always with us. We need to make sure that we are able to model every part of our body, the immune system, the brain, our liver, everything. We need to have a digital journey into our body to make sure that things that we experience are digitally experienced. We dream of a future where even before, needing to experiment new things on humans, we will be able to actually know if something is effective, to know what works and doesn't work for us as an individual. That's why genomics, mentioned by the Commission, is so important in terms of creating the digital twin of our body. We want to have this digital twins project, the body, the earth, as a center of our renewed effort in our supercomputing program. We just announced 8 billion investments in Europe for supercomputing leading into quantum computing, and part of it is creating the digital twin of our body and the digital twin of our heart. We need to know everything of our medical life. We need to have a data record that is interoperable, interchangeable, and that can be utilized if we want to do so, so under our control, to actually pass on our medical history to whoever has a need to actually do something about our health. Again, as I said at the very beginning, we have a lot of control on our lives when it comes to our digital life. I think it's fair to say that when it comes to our medical life, we still are in the Stone Age. We really have a primitive control of many, many things. We need to bring this to the next level, but without having all of us an healthcare record, which is comprehensive of everything around our body, which is secure, which can be shared in a format that can be exchanged, there will be very little advances. So that's our other flagship project. To conclude, there's a lot to do. Healthcare, in terms of digitization, is in its infancy. We are still primitives when it comes to using computing, the power of genomics. But I have the impression that if we focalize our effort, if we increase investments, well, it will not take 2 or 3 ages, Stone Age, Copper Age, Iron Age, thousands of years to get to where we want to be, which is an empowered human being with this digital copy available. But it could be, something that happens quite quickly. So with this hope, I thank you for the attention, and I wish a very good intensive session of Connect University. Thank you very much.
Director General Roberto, Viola from DG Connect in the European Commission, thank you very much for this very interesting and also comprehensive introduction to the topic that we are on for today, which is the digital health issues overall and what we are doing in this area and why it's important. Thank you again, Roberto, for that. But I will not let you totally off the hook yet, Roberto. We have in a moment waiting for us to, with an introduction, to give Deputy Director General Claire Berry from DG Health and Consumers in the European Commission. But before we leave this to Claire, Roberto, I wonder whether you could have a couple of questions that I will pose to you now. And the first one would simply be, Roberto, why do we need now a push for the digital transformation? And secondly, what do you see as the main challenges?
Thank you, Morten. As I said, now or never. I think this crisis has shown how weak we are in terms of having a complete understanding of our body, our immune system, how weak we are in organizing the data, in exchanging medical data. I think also that this crisis has shown how strong we are in Europe to have planned the recovery. So this mix of weaknesses and strength is the reason why we need to act now.
Roberto, thank you very much. I have a second question, which is you mentioned the digital aspects of responding to COVID-19. What has been your experience specifically in working on these aspects? I'm thinking mainly about sort of the digital and data modeling. You have already introduced this a bit as part of your speech, but can you elaborate a bit, especially perhaps also what you have seen as the major challenges that you were facing?
Thank you, Morten. I tried to say in my speech, not very much in between the lines, but in a very direct way. All these technologies are nice, but then you have always to understand that they need to be used by a human being. So when it comes to using very high technology in the hospital scene, you have to be sure that the doctors at the time have the attention to this and also understand a little bit the technology they need to use. And this, of course, I mean, in times of emergency, it could be a crash course, but then when it comes to a more structural transformation, we need to make sure that health professionals have a digital culture. That's why, I mean, we have the Connect University, among other things. We need to make sure that digital skills are part of the CV of every trained healthcare professional. And in general, I mean, the teamwork has been very much the essence of our work. When it comes, for instance, to use data, as I said, you have to make sure that the data you use are not violating the rights of people, in particular, the privacy is respected. That's why you need teamwork of different specialists, I mean, data specialists, privacy specialists, and I really thank the European Data Protection Supervisor for the precious and very continuous support to our work, and also all the data protection authorities around Europe, which joined forces with us, and all the colleagues of the European Commission to make sure that what we were doing was not only effective, but also respecting the private life of citizens. I don't think we're given up on it, on the contrary. So there's no compromise here to be made. There's no compromise between healthcare and privacy. The two things can go very much together.
Roberto, thank you very much. And if you don't mind to stay tuned, please, because I will now pass the floor to Deputy Director General Claire Berry from DG Director General for Health and Food Safety in the Commission. And then Roberto, we will come back after Claire has spoken. We will come back and take questions from Slido, and we will take questions also perhaps that I also would like to pose to you and to Claire Berry afterwards. I will encourage all persons who are online to use the Slido with the questions that you would like for me to pose to Director General Roberto Viola from DG Connect and to Claire Berry from DG Health and Food Safety. Now, Claire, I will turn over to you, but if not without allowing a short introduction to you, because it's with particular pleasure that we invite you today. You were previously the Deputy Director General here in DG Connect, and now you have changed to another very important Directorate General, the DG Health and Food Safety, where you are responsible for food safety and also sustainability. You are also a visiting professor at the College of Europe. You have done many previous important posts here in the European Commission. I will leave it here, Claire, because today is really about digital health. It's about also your new responsibilities, and we'll be looking forward to hear your intervention on this. And to all participants online, keep the questions coming on Slido meanwhile. Claire, please.
Morten, good morning. It's a great pleasure to be back in DG Connect, virtually, albeit, but that's very appropriate, I think. And it's such an honour for me to be here at the Connect University this morning on this session on digital health, which is an area that I'm very pleased to be working in now. It's an area where the impact on citizens is very clear, it's very obvious. And in my time in Connect, those were always the areas that were closest to my heart, so it's really a great pleasure now to be working on digital health. The cooperation, I think, between Connect and DG Health is already excellent, but I hope also that I can have the link even stronger now that I've moved over. I want to say, if I may, I want to talk about three things this morning. First of all, how digital solutions can transform healthcare. I think Roberto's been talking about that a little bit already, but maybe to go into a little bit more detail for you about how we see that from a DG Health perspective. Secondly, I want to talk about the European health data space, which is, again, a great area of collaboration with DG Connect. And then I want to finish by saying a few words. Roberto, you've already mentioned a bit about the contact tracing apps and so on, but I want to say a little bit more about digital health and COVID and how we've been able to see some advantages of digital technology there in terms of treating this pandemic. So, first of all, in the report on the state of health, if we can just move into the first slide here, please. So, in the report on the state of health from 2019, the EU concluded that it was only really by fundamentally rethinking our healthcare systems that we can be sure that they remain fit for purpose. And I think obviously the pandemic has shown us that very, very clearly in terms of the challenges that it's put on our health system. So this means that our health and care systems really require reforms and innovative solutions so that they're more resilient, they're more accessible, and they can provide the kind of services that citizens need. Now, if we can do this, then the solutions for citizens will be very significant. But to radically change health systems to make sure that services are delivered to patients, the solutions that we provide have to be delivered purposely and implemented in a cost-effective way. I think Roberto was explaining there that what he was saying in his presentation was that it's all very well having the digital technology, but if it can't be used by those who are in practice in the healthcare system, then we haven't really met the objective. So I agree, Roberto, that health is digital. It doesn't really make sense anymore to talk about digital health. Health is digital. So we should, when we mention health, we should already or automatically think this is digital. I think you're right, it requires more than a pinch of salt of technology in health. But health is already digital, and it's now or never. I think, as you said very clearly, Roberto, the challenges that we've faced over the last few months have shown us that now is really the time to transform the health systems. Now is the time to seize the opportunity, which already in 2019 was saying that we needed to bring our health systems up to scale, up to par, so that they can serve the needs of our citizens. Now is really the time to do that. So if we can move to the next slide, please. Okay, this is just showing you the state of the health in 2019, but let's have a look at how digitization can help the health systems. So first of all, it can, as I was mentioning, support the reform of systems and transition to new care models which are based on people's needs, and shift from hospital-centred systems to more community-based and integrated care structures. So this way, digitisation of healthcare can play a central part in facilitating socio-economic inclusion and equality, quality of life, and patient empowerment. Secondly, digital tools can offer new ways for individuals, including members of vulnerable groups, to actively participate in the management and monitoring of their own health. So if we get it right, we can reach out to some of those who are the least advantaged in the population, but we need to be very careful about how we do it to make sure that we do that. It can also assist health professionals to collaborate between each other and with their patients. So better use of health data in research and innovation can lead to more effective healthcare and social care systems. I think Roberto was talking very much there about how digital tools can be used in research, and if we can make sure that the research transitions into the daycare, then we can see how we can transform our health systems. And thirdly, digital tools and new technologies such as mHealth, wearables and apps can help citizens to actively engage in health promotion and self-management of chronic conditions. So this can control the demand that we have for health and care. It also enables citizens to provide feedback and data to their doctors. It can therefore improve the quality of health services and the people's well-being. Now, during the COVID crisis, I think as the Commissioner said in his introduction, we see many examples of telehealth solutions, telemedicine, telemonitoring and virtual consultation models, which can ensure digital access and continuity of care in scenarios where face-to-face visits are not possible or they're not safe. So we've seen how the digital solutions can protect and connect patients with healthcare professionals and with each other, providing safe means through which consultations and informational exchanges can be carried out. Ensuring that personal data protection and privacy is ensured, that's absolutely crucial. Roberto mentioned it too, I'll come back to it in a moment. Secondly, the European health data space. This is one of the main priorities of the European Commission in the area of health. In fact, I would say it's one of our flagships. It was proposed already, mentioned in the European Strategy for Data earlier this year. It's been confirmed very recently in a special session of the European Council, and mentioned also by President Ursula von der Leyen in her State of the Union speech last week. The idea behind the health data space, if we could just move on to the next slide, please. So here you have, okay, thank you. Can we move on to, that's it, thank you very much. So here we have Stella Kyriakides, who is our Commissioner, explaining what the importance of the health data space is, and that at the end of the day, it should hopefully ensure that citizens have control over their own personal data. But we want to have better research and innovation, we want to have better policy making. Using the data that Roberto mentioned is so crucial to what happens in this area. We should then be able to have better data exchange and support research on new preventative strategies, on treatments, medicines and medical devices and outcomes. Could we move on to the next slide, please? So there we are, you have on the left-hand side explaining what the data can be used for, and on the right-hand side we have what the European health data space will consist of. We will have data governance and rules, we will have data quality and interoperability. Of course, we need to put in place infrastructure and technology, and last but by no means least, capacity building and digital skills. We're currently working with the Member States on the question, the first issue there, which is data governance, not just with the Member States, but also with the stakeholders to set up a good governance structure and the financing, of course, for the infrastructure and technology that we need. We've been doing this through and with the assistance of the German presidency for the moment. So we've had a number of expert workshops in the first half of 2020, mapping the national health data policies and rules, so we can see where we need to bridge the various gaps between the member states in bringing them together in this health data space. And the preliminary results of this were presented to the health ministers in July 2020, and the report will be published by the end of this year. And as was announced in the data strategy in February, before the end of this year, the Commission will come out with a horizontal governance structure for data, and the health data space will complement the overall structure and will be adopted somewhat later in 2021. I want to, on this particular topic, underline the importance of input from all the stakeholders, including the member state authorities, the healthcare providers, the health professionals, researchers, patients and industry for the success of this endeavour. We need all of those stakeholders to work together to be able to get to where we want to for the health data space, so that we can deliver the better healthcare, the better policy making and the better research that we're looking for. So thirdly, I'd like to say something about the challenges that we have been facing in relation to COVID-19. So Roberto, you talked about the contact tracing apps. You said they're not wondrous, but we do have a breakthrough. We also know that the data tracing apps have been used in virtually all member states. So I think this shows that across the member states, the stakeholders, if we can just move to the next slide, please, the stakeholders see the benefits of having the contact tracing apps. Sorry, this is still recalling for you the benefits of the, if you can just keep, can you keep going on with the interactive part of the slide? Okay, maybe there isn't any more of that one? Okay. I thought there were, okay, there are more. This is just filling in for you on the data space. So on the contact tracing apps, Roberto, you mentioned that it's not a panacea, but it is a useful tool for member states, and we see that. So we have been working on setting up what you described as the gateway, which is to bring together member states' different apps. We were not so ambitious to try and set up one app across the whole of the EU, but recognised, of course, that member states would want at least one app in their own country, maybe in some countries even more than one app. So what we've been spending lots of time and energy on over the last few months is the gateway, which will bring all the apps together. And we've made significant progress. We're hoping that in the next couple of weeks we will have the pilot phase where 7 member states will already be able to exchange data between them. Can we move on to the next step, please? Sorry. Okay, so here we have the contact tracing. And the apps can complement manual contact tracing with several benefits in terms of the time, the volume of the contracts. We can many more of the contacts that have been made, and giving out information and guidance on the basis of the apps. Can we move to the next slide, please? So, in addition to the apps, I wanted to mention what we call the European reference networks, which are virtual networks which facilitate discussions between clinicians. So the one thing that we have done during the crisis is that we've used the European networks to help clinicians dealing with COVID-19 patients. Based on the existing model of the European reference networks, which we've used for rare and complex diseases, the Commission has launched something which is called the COVID-19 Clinical Management Support System, or the CMSS, which provides frontline clinicians dealing with COVID a platform to exchange knowledge and discuss patient cases. This support system has also developed a series of clinical webinars on COVID-19 and rare complex diseases, presented by renowned experts from the European reference networks. Given the experience that we've had with the CMSS, with the support system, which has been extremely positive, we will be extending the reference networks on a permanent basis to cover COVID and other pandemic diseases. I think COVID's shown us, of course, the need for continued cooperation on cross-border exchanges of patient summaries and prescriptions through the existing e-health digital service infrastructure, as well as the European Electronic Health Record exchange format, which you mentioned, Roberto. If we can move on to the next slide. Oh, thank you. In order to enable citizens to access a single consolidated electronic health record across borders, 7 member states already exchanging patient summaries and e-prescriptions. To deal with COVID, some member states are analysing the exchange of images and laboratory results and discharge letters in the language of origin. So the pandemic presents a huge burden for the healthcare systems, but at the same time, it provides an opportunity for 3 things. First of all, to realise and better use the potential of digitisation. Secondly, to make sure that with the help of digital solutions, our healthcare systems are better prepared for the future challenges. And third, that we can use digital technologies as the basis for the stronger European Health Union that our President, Ursula von der Leyen, announced in her State of the Union speech last week. Thank you very much, Morten.
Deputy Director General Claire Berry from DG Health and Food Safety in the European Commission. Thank you very much for this introduction. And also, Claire, I will not fully let you go yet. So just like Director General Roberto, Viola from DG Connect, I will ask both of you to stay on. And I will ask you to stay on also because now we, after the 2 presentations and after the video message of Commissioner Thierry Breton, the Commissioner for the Internal Market, we will now for the next hour or so turn to questions that I will pose you. And specifically also I would welcome the participants online to use and engage via Slido and come with questions that you would like to pose either to Roberto, Viola or to Claire Berry or to both. So, but the first question, however, will be from me to you, Claire, and contact tracing apps was a bit in focus in Roberto's speech, but also in your speech. And I can already see that there's a bit of interest on Slido also for this contact tracing app, so we may come back a bit again to this. But right now, Claire, I would like to understand a bit from your side, how do you see that we can increase the uptake for the contact tracing apps, and how important do you view that to be?
I think, first of all, it's crucially important that we increase the uptake. As Roberto mentioned, you can't really put a definite figure on how many members of the population should do it, but it's clear that we need a significant number of people to be using the apps to be able to correlate the data and for it to be useful. Secondly, what can we do about that? I think the first and the most important thing is trust, of course, that citizens trust in the apps. What does that mean? It means that there's compliance with GDPR, with the General Data Protection Rules, and also with our e-privacy rules. Both those sets of rules were intended to increase trust, and there was a lot of time and effort that was put into developing the apps to make sure that all of them are as privacy friendly as is possible. So I think when we communicate, as we must do, of course, because citizens need to be aware of the apps, they need to be aware of what the apps do, they need to be able to understand simply how the apps are going to be beneficial towards them, how it's going to be, Roberto said, I think, a gest of solidarity towards their friends and their family. We need to communicate that these are safe and that they can trust because the European rules, which we have elaborated, are being complied with. I think, secondly, of course, what's important as well is that there are secure cybersecurity measures, that we need robust cybersecurity measures in place. And again, I think that in working with the member states, this has been top of the agenda to make sure that that's the case, that data is very well protected in terms of following the rules, but it's also very well protected in terms of the systems being secure.
Thank you very much, Claire. I will, and we may come back to the tracing apps a bit later because I can see on Slido that there's some questions on this as well. But before that, I would like to ask you a second question, also very much linked to the role of your Directorate General and in the liaison with the member states here. How do you see Europe best supporting national healthcare systems?
Well, we have put forward a new programme which is called EU for Health. which will be now a very important programme in the EU's budget. It's going to be 4 times bigger than the previous programme that we had on health. It's going to focus on 3 key areas. The first is preparedness and prevention. Obviously, after the pandemic, we now know that that has to be top of our agenda. Secondly, available and affordable medicines, medical devices and essential supplies. Third, stronger health systems. So through this EU for Health programme, we hope that we will put public health at the priority of our next MFF. It also, the pandemic has told us, of course, how important it is that the member states work together. So we need to do complementary financing of projects. And that needs to be the case, not just with the money that member states put in, but also with other money that the EU might contribute. So there are other programmes like the Digital Europe programme, which has been very much the forefront of the efforts of the colleagues in DG Connect for the last couple of years. And now it's the first time that we have a separate digital programme in the budget, which is excellent news. And we hope that some of that as well can be for health matters. And through Horizon, we have to continue on the research funding, of course. And through complementary work with the member states in the Recovery and Resilience Facility, which has been agreed. But I wouldn't like to finish without mentioning skills. I think Roberto mentioned it too in his intervention, that it's absolutely critical that we ensure that our clinicians, that our nurses, that our care workers are all equipped as much as possible with digital skills. So I think this is another area where we need to, across the Commission, ensure that the colleagues who have funding in skills are also putting it into training our healthcare workers in the right way. Thank you.
Thank you, Claire. I will turn to Slido, and it might be slight paraphrasing of the question I just asked you, Claire, but I want to make sure that we are giving you the chance to cover the question as it looks on Slido here. The first one is from Marian, who asks, healthcare is under the competences of member states according to the treaties. What is the grounds of the digital transformation of the health systems?
Well, I think at the moment, currently under the treaties, it's the responsibility of the member states. But we saw from the pandemic, I think, that we will certainly, Ursula von der Leyen recognised this last week, that this is something which needs to be discussed in the Conference on the Future of Europe to see whether it wouldn't be appropriate to reinforce the Union's powers so that we have a stronger European health union. But of course, we'll have to wait quite some time for that. So what do we do in the meantime? What we've been doing with member states is that it's a process where we discuss with them, we bring our skills and competences to the table, and we persuade them that we should work together. And I think the member states in this area are quite open. Of course, they are not going to immediately say, we hand over everything to the Commission, but they're very willing to work with us. We have great synergies in terms of the way that we work with member states, and they recognise that we can have added value, especially if we work in the way that we have been doing, which is, I think, to show that we're very much joined up within the Commission, between the Health Department and between DG Connect, which is really at the cutting edge of digital skills. So I think it's by slowly convincing member states that we are competent, and I don't mean competent in the sense of have the legal powers, I mean competent in the sense of understand and have skills and know what we're doing, that we can then bring the member states on board.
Thank you very much, Claire. And I think also there was a similarly a nuance on the same question from Ritis Viabalis on how to achieve digitalization of healthcare in all member states when healthcare remains national responsibility. But I think this was indeed what you have now answered, those two questions from participants sitting online, which was questions that were very much on their mind. And also I can see, because there's a voting system on Slido where you can upvote questions, and that was two of the most upvoted questions so far. I will go now a bit more to the sort of the financing side. There is a question from Paul Michelou, to you, Claire, as a follow-up on your presentation on the program EU for Health. So what is your understanding on the current MFF discussions since the program is looking differently at the moment, and Paul writes here, since the program is clearly cut for the moment, what can you tell participants on the state of play for EU for Health?
So, yes, you're right. The member states cut the budget from the 9 billion that the Commission proposed. But what we see at the moment is that we still have 4 times more than we had in previous spending cycles, as I mentioned. I think the mere existence of the programme and the priorities in it with a bigger budget is important. We are hopeful because the Parliament has expressed sympathy for the Commission, and the President mentioned this in her speech last week as well, before the Parliament, that we are hopeful that the Parliament will, in its negotiations with the European Council, encourage the Member States to put more funding in to be spent jointly, rather than just to have funding that they will have themselves through the Recovery and Resilience Facility. So we are still hopeful that we may have more funding. Obviously, it's not going to be as much as the Commission originally proposed, nor is it going to be a huge amount. So that's why we have to be very careful, I think, about what we choose to spend the money on. We have to make sure that the money is spent in areas where we can act as a catalyst. And I would say that digital is one of those areas. And I know, and I'm personally fighting very hard to make sure that we have a significant part of the funding of the EU for Health which will go into digital, because I think that that will be money very well spent.
Thank you very much, Claire. Could I turn also a question on the financing side to you, Roberto, Viola, as Director General also of DG Connect. The financing of digital transformation of health, how do you see it from your perspective? And also a second question related to this, what is available for the member states at the EU level, and can you also introduce the issue of the proposed recovery and resilience facility, and whether that may be of help in this instance? Roberto, a bit convoluted question, but there's 3 questions in one, so I'll let you go on that, please.
Thank you, Morten. And to answer your question, I would say last week there was a Tuesday and there was a Thursday. And in between there's been a Wednesday, which is a truism, of course. And I explain you, why I started with this truism. I think on Tuesday, Claire and myself, of course, we were still counting, what could be done in the area of healthcare, especially the digital transformation of healthcare. And indeed, we have been faced with some cuts on the programs we have announced, but we were full of hope that there could be some focus in the recovery fund to transform the healthcare system. On Wednesday, the President announced that she wants to transform healthcare in Europe, and she also announced that 20% of the recovery fund should go in the direction of digital transformation. On Thursday, we started to work all together to make sure that we have the right criteria, and one of those, of course, as you mentioned, is that we need to spend this 20% in the digital transformation of healthcare. Now, this is an unprecedented effort. It's really a breakthrough, which makes me full of hope. After so many years working in the sector of healthcare, I'm a seasoned expert in this area. I started with video conferencing during the Yugoslavian war to help the hospitals which were bombarded, so count the years. I never seen in my professional life such an opportunity. So I think we should seize the opportunity. Member states should be now very, very serious to plan the digital, well, the transformation of healthcare. I mean, digital, as Claire said it very rightly, it's just, the right ingredient to make it happen. So the central issue here is to make sure that you have a human-centric, data-oriented healthcare system. And beside the words, beside the concept, beside the technology, now maybe there are also the funds available to do that. So I do hope that every member state will put the transformation of healthcare at the center of any plan about recovery.
Thank you very much, Roberto. We will go on a bit to an issue around between accessibility and security, if you will. The sensitive nature of health data is the critical aspect here. Can you give us, I'm asking this question to you, Roberto, can you give us more information as to how exactly the right infrastructure can help to square sort of this apparent contradiction between accessibility and security?
Thank you, Morten. I said before, accessibility and security should not be enemies. They should be friends, and we should make sure that the healthcare data space, which I agree with Claire, is a central piece of our modern healthcare strategy. And for sure, we will be extremely committed to help our colleagues of DG SANTE to make it a success of it. We should make sure that this health space is secure by design, respects privacy by design. There cannot be any advance in this respect if we do not plan this together and make sure that we are able to gain the citizen trust and the institution trust that this construction is solid. I mean, it would be like, you project yourself into a very nice apartment, but without the windows. That doesn't work. So here it's the lock at the door, it's the windows, it's the whole structure of the building, which has to be solid. And this solidity is about security and privacy.
Specifically on contract tracing apps, Roberto, there's a question from Teresa online on how to make sure that national apps for COVID guarantees the same kind of data protection when connected through the Commission platform or the Union platform that is being rolled out.
Thank you. I think this is a good question to clarify how the gateway that is installed in Europe works. The gateway is a very stupid system at the end of the day, because the gateway does not store data. The gateway simply makes sure that if you are tested positive in one country and you visit another one, the people in the other country can know. So simply forwards the key to the other country. So it doesn't change in terms of the security of the national apps. It simply connects and adds to it, in terms of even the robustness of the system. The system has been realized in software which is open, the software has been published, has been seen and tested and commented by thousands of people around the world. And as Claire explained in the beautiful slides that she showed, we have been working on the regulatory safeguards and the technical safeguards to make sure that the operation of transferring these keys is in line with data protection rules and is safe and robust.
Thank you very much, Roberto. I will turn to a couple of questions to Claire. And let me just get to the right one here. So Claire, there's a question from Giorgio. on the fact that 7 member states exchange of e-prescriptions through the European Health Data Single Infrastructure. And here the question, which I managed to lose for a second, just a second here, I'll come back to it. So the question from Giorgio is that it took several years to get there, and how can we then speed up on this EHDSI? Claire, please.
Okay, Giorgio, so thank you very much for your question. I think, as I mentioned in the speech, one of the things that we have noticed is that the pandemic has not just accelerated cooperation in terms of what happens on COVID, but I think it's also given us a real push in terms of what else is happening in the health system. I think that the member states are committed now to moving forward. I think the political will is there. The fact that we've already broken through, if you like, with 7 member states in terms of the technology means that it shouldn't be that difficult now to roll it out to the rest. So I think that the COVID effect, if you like, is helping us in that respect in terms of moving on lots of fronts, and people seeing the benefits much more quickly than they might otherwise have done.
Good, and thank you very much, Claire. I will take a question now which has been quite upvoted from Stanislav Danchev at the ECDC in Stockholm. So, Roberto, this is for you, and you're being thanked for the interesting presentation. You mentioned that we are joining efforts with the US and other countries. Can you elaborate here, please? How, when is this joining efforts, how is that taking place? Roberto, please.
Thank you very much. First of all, this allows me to thank Stanislav and all the colleagues of ECDC for the fantastic work they are doing. We have been working as partners together with DG SANTE in many aspects. And also we have been throughout this pandemic refining the way we understand data about the spreading of the virus, the models, and their suggestions and their involvement has been very precious to us, to DG SANTE and the colleagues of JRC. It's really a very powerful team that allows us to do some advances, some important advancement. Of course, in this fight, you never can use enthusiastic terms to describe the success, but I would be enthusiastic about the cooperation and hopefully also in the near future the success. Now, the cooperation of US, what is going on is that there have been, basically we have these 2 large platforms for brokering supercomputing capacity. The European one is managed through the PRAISE consortium, which is a consortium of supercomputing centers that offers capacity. And in US, it's an initiative under the leadership of Department of Energy. We have been offering scientists and researchers to use computing platforms, and we are in regular contact to exchange ideas and results. Also, we have a special platform that the Commissioner mentioned in the introduction, which is called Escalate, which is a platform that allows us to actually test in silico the effectiveness of remedies against the coronavirus. So basically, we have now a quite refined 3D model of the protein of the virus, and we are checking this against the billions and billions of existing compounds. And to do this, you can imagine that our supercomputing are working 24 hours a day. Now, the consortia links many different excellent centers in Europe and companies. There's one thing I like to mention of this, which is the so-called medicine in the box grouping. This is basically a number of pharma companies coming together and sharing information about their compounds for the testing on the supercomputer. So it's a data sharing agreement which allows now to test really, I mean, all the possible libraries against the existing remedies against the structure of the virus. I think this is an interesting model. I mean, where the pharma companies decides without, I mean, any constraint. I mean, it was a free decision to come together to share and to allow our supercomputers to screen the results. Looking at the in perspective of the European health data space, I think it's an interesting model, and of course, it brings the whole issue about governance of data spaces. And it's not a mystery that the European Commission wants to do something about the governance of data spacing in terms of presenting legislation that would allow a simpler management of those data spaces. So the combination of horizontal legislation about data spaces and then vertical initiatives on the healthcare data spaces, I hope will give a powerful structure for using at best things like computing and big data.
Thank you very much, Roberto. I will actually ask you, Claire, the same question around the way that you, from the perspective of the Director General for Health and for Food Safety, how do you join efforts also with countries outside the European Union? Claire, did we lose you there for a second?
Sorry, is that back again?
Sorry, you're back, Claire. I can
Okay,
easily
all
hear
right.
you. I cannot see you right now, but I can easily hear you. So were you lost, or could you hear my question?
No, I think I heard your question. You asked about how we in DG Health collaborate with third countries as well.
Indeed, absolutely.
Okay.
Thank you.
So I think we don't have any of as elaborate or advanced a plan as Roberto has mentioned in terms of the work that's going on with the US and others. But of course, what we do is we have very developed relations, in particular through the WHO and other organisations. But we are more in terms of sharing knowledge and working together and meeting and collaborating in that way, rather than having joint projects, insofar as I'm aware at the moment.
So thank you, Claire, for this. We'll change topic to something else, which is quite exciting and also having led to questions on Slido, and that's the issue of counteracting fake news. So there's a question from Alex on how do you see the digital ecosystem going forward in terms of counteracting fake news and information, and also how will this affect the trust in the health systems? I will ask the questions to both of you. Roberto, would you start on this one, please?
Well, even before the crisis, we considered disinformation as one of the things to fight, unfortunately, in health. It's a disease that can cause serious damage to our population. Wrong information about remedies, for instance, in very serious illnesses such as cancer, with things that have no scientific base and can harm people, on theories, conspiracy theories that can distract people from the real therapy, or, I mean, fantasy stories about vaccines that we have seen how much they are relevant to protect the population from pandemic. This is a real plague. It's the plague of this current century. We need to fight it as much as we can, because the damage in terms of life loss can be very high to this. And it's a damage that is difficult to account, you know. That's why, I mean, from day one, we have joined forces with the colleagues of DG SANTE, DG Just, to make sure that it's not just, I mean, this information about the social life or the political life, but we fight also this information on the scientific side and the medical side. During the pandemic, this has been even more acute. I mean, with all sorts of stupid things being circulated or things done intentionally to destabilize our society, which is even more dangerous. There have been many stories. The most ridiculous one, or the most ridiculous, has been the story of 5G linked with the pandemic, which has been, of course, I mean, every international organization, from the World Health Organization, from our side, from other bodies internationally, have explained something which, of course, common logic would help to explain, that there cannot be any link. But still, as this has led the people to attack antenna masts and destroy cellular sites in a moment where everybody needs communication to stay connected with friends and family, but more important to work, more important to stay connected with healthcare professionals. So this has been really an attack at the center, at the very center of the functioning of our system in an emergency. So that's why we want to reinforce our fight against disinformation and make sure through the code of conduct that we assigned with all the platforms that they also make their contribution. We have recently published an evaluation of this code. We have seen many things going in the right direction, but also the need to do much more.
Roberto, thank you very much. Claire, can I ask you exactly the same question from Alex on counteracting fake news and how this affects trust in health systems? Claire, please.
Okay, thank you, Morten. Well, I agree very much with what Roberto's just said, but back in June, I think the Commission, we adopted a document about just this subject, which is disinformation around the pandemic, and it was agreed there that we should bring on board all the actors, that is the platforms and others who've been involved in the code of practice on disinformation, that we should bring the disinformation around the pandemic into that code as well. So that means that there was a significant step forward there, I think, in terms of getting the actors to recognise that all the tools that they have been using about disinformation in general should also be used about the pandemic. Obviously, I think when we go into the area of vaccines, as Roberto said, there is a significant amount of disinformation that goes on, and there are, of course, the anti-vaccine campaigners and so on. The Commission's spent a lot of time and a lot of effort this summer in purchasing, in having options on vaccines. So working basically on making sure that vaccines will be available as quickly as possible. Now, these vaccines will be new, of course, so people will be worried about using the vaccines. They'll be worried about the fact that they've been developed rather quickly. The previous efforts on disinformation show us that what happens with those who are involved in disinformation is that they prey on people's fears. So I would imagine that there will be a significant amount of disinformation around vaccines when we come to a vaccine being available. So I think at that point we will have to, I think we should make a preemptive strike there. I think we need to act quickly beforehand in terms of both educating people about the vaccine and the dangers of not being vaccinated, but also in terms of making sure that the news is, the fake news is not out there so that it doesn't do the damage, because the risk will be very significant, I think, in that respect.
Thank you to both of you, Roberto and Claire, for the answers to this, which is clearly both interesting but not always for the right reasons. Now we turn to an issue of health data and the ownership of health data. There's a question from Piero Rivizzino, which is the strategy on the ownership of health data, and would eventually the patient be the owner of his, her own data? And there's a related question also from another online participant on whether you plan to initiate proposals for improving GDPR for health data. So health data issues. Claire, if you allow me, I'll ask you first, please.
Thank you, Morten. Of course, it's a very important question, because everything that we want to do around the European health data space and so on relies on this, and we know that rightly people are sensitive about what happens to their data. I think I'll just go back to what the Commissioner said about the health data space, which is that the idea of this is that we put citizens in control of their personal data. I think very often people are not aware of what is their data and what is not their data. But what we want to do is to try and put them in control of their data, and that means consenting to the use of their data when it's necessary. I think there is indeed scope for some improvement on GDPR on this question of health data. So it's something that we're looking at and very carefully.
Thank you very much. Roberto, would you like to supplement on this question, please?
Yes, thank you. I think Claire rightly said citizens need to be empowered. Now, the first question to tackle is that you asked, I mean, it's who owns the data. I think in case of healthcare, there should be no doubt. I mean, the citizens are owners of their healthcare data, and this ownership right, so to say, is guaranteed by the General Data Protection Regulation. They can have access to their data wherever they are. They can ask the deletion. They can move the data around inside the European Union at their will. That's the beauty of having the same data protection rules around Europe. And I think we have seen over and over that an horizontal regulation about data protection works, and there's no need, I mean, to change it if this was the part of your question. But that's indeed the need to empower citizens. So the first, as I said, I mean, the way we will work on data policy is that from our side, DG Connect, you will always expect to tackle horizontally issues about data policy. And then from the friends and colleagues of the DGs, which are responsible for the various sectors, you will have sectorial initiatives. The same will be, of course, when we look at how we will work together with DG SANTE when it comes to generic issues about data governance and specific issues which relate to healthcare. Now, the generic issue is, as Claire rightly explained, is the empowerment. Now, generic issue empowerment has two aspects that we would like to tackle. The first one is the so-called data philanthropy. So, during this crisis, people have been asked to contribute with donating money for initiatives. Nothing can be done of significance if citizens voluntarily do not participate to the advancement of digital healthcare. But, I mean, to donate data in an anonymous way or to make sure that this can happen needs some rules, some protection, some guarantees, very much as, I mean, the money donation, other donation schemes are regulated to make sure that, I mean, only those schemes which have public interest can go ahead. Now, this is something which is foreseen in the GDPR, but now we need to action it. And that is one of the objectives of our data governance legislation that we would like to present. The other thing is about personal data spaces and the use of electronic identity. Our president on Thursday, she explained that the way to empower citizens in the modern world, in the digital world, is to make sure they own their identity, very much like in the physical world. Through their identity, they can access many things, including the health data record, and control and make sure that they give permission to those actors they want to give permission. It's unacceptable, and we will not, this will not happen in Europe, that some private actor would decide for the medical life of citizens what can be stored, what can be displayed. This is the sole decision of the citizens. But in order to action this right, which is sacrosanct, you need the right technology and the right rules. The technology to actually be able to use your identity in personal data spaces, and the rules in terms of data governance and the governance of the health data space to make sure that everything functions well.
Thank you very much, Roberto. Just as a reminder, at this point in the session, we are at the Connect University Autumn Session. It's the 5th anniversary of the Connect University. We are launching today the autumn session for this, which is the focus on digital health and giving a European perspective on the transformation of healthcare enabled by digital. We have with us Director General from DG Connect in the European Commission, Roberto Viola. DG Connect is the Director General in charge of communications networks, content and technology. And we also have with us Deputy Director General Claire Berry from the Director General SANTE, which is in charge of health and food safety, also in the European Commission. We have 300 plus connected colleagues and participants, other participants online on Slido. Thank you very much for being here. Thank you for staying with us. We will have some more questions from the Slido feed, and you are still welcome to post your Slido questions. And then I'll make sure that we have you out of here at the latest by 12 o'clock. And before leaving you, I will also announce the next sessions, because today is only the opening session of the Connect University Autumn Session. We still have 10 more sessions to go over the next 2 weeks on different aspects of digital health. Roberto and Claire, I will ask you now a question on, and you have alluded to it a bit on occasion, but if you were to single out one or two of the biggest obstacles to enabling digital health in healthcare, which would that be? Claire, I will ask you first. So the biggest obstacles to enabling digital health across healthcare.
I think I would say that one of the biggest obstacles is possibly those who work in the healthcare sector not having the appropriate skills. I think, as I mentioned earlier on, this is hugely important. Quite often, those who work in healthcare maybe think that technology is not their best friend, that they don't believe in it so much, or they can't see the benefits of it. But I think that what we have to do is to be able to demonstrate to them the benefits in a way that they will be able to embrace it, but also in a way which will make them think that it's worth their time as well, and the extra effort and investment in the digital skills, and that we can make the relevant trainings available for them. So that would be, I think, one of my top picks in terms of one thing that could stop us from going quickly in this and moving and getting the full benefits out of it.
Thank you very much, Claire, for that perspective. Roberto, Viola, from your perspective, what would be the answer to that question be? What is the biggest obstacle in using digital health across healthcare? We'll see if Roberto Viola comes in. So
yes. Can you hear me now?
Yes, we hear you very well, Roberto.
I was unmuted. So I was saying that I agree with Claire. It's skills, but I will offer another one, not to repeat what Claire said, but let me stress one thing about skills. We know that trained human beings, they make mistakes, and that is clear in the history of aviation or what happens in cars and in professions when they are overconfident. And now, I mean, for the medical profession, there's a beautiful tool which is called the internet. We have been discussing many times with the relevant associations the fact that very few general practitioners are savvy in utilizing it. There's no shame in trying to understand better what's going on. I mean, even a very skilled and trained doctor cannot know many things that now are available in terms of open resources. But of course, searching on the internet is far from being easy. So this is just a little example why, I mean, this is important, and there are many, many others. But let me offer another one, because the skill was already taken, which is the absence of a medical record for every European citizen. Without a complete, well-functioning, accessible, secure medical record, we will remain a kind of club of amateurs when it comes to healthcare. This is the element that, together with skill, ignites the transformation. Because with the medical record, then you can link, you can understand, you can, for instance, have each of us having the genomic passport and link it with illnesses. Today, I mean, it's like, I mean, we are in a little bit in the caves with a very little light that just illuminates what is the space around us, but we don't see the rest. That's, with the medical record, would be like having a large flame that illuminates this cave.
Thank you, Roberto. Then a question from another participant on where it essentially reads out, how will we avoid smart health becoming yet another vertical, and that is then being defined as a standalone digital initiative like smart lighting, smart energy, smart mobility. So I guess there's a bit of tonality in this question on actually the comprehensiveness of the smart health. Roberto, would you go with this one?
Well, I mean, smart health equals a smart life, a smart society. I agree with the question, I mean, or what is behind. I mean, we should not put the healthcare in a box and forget the rest. That's why, I mean, working together in the various policies is ever so essential. And that's why, I mean, we need horizontal rules for the digital economy. But at the same time, and this was not the case in the past, we need focus on healthcare. Very little has been done in the past. I think our president was very clear about this. So it's really time that we give the right priority to healthcare and digitization. As I said in my introduction, we know how beautiful it is to use artificial intelligence for shopping advice. I don't think the same amount of money has been spent in artificial intelligence in healthcare, but maybe it's a bit more useful. But of course, you cannot expect a private actor to substitute for what is the fundamental role of public actors. That's why, once again, let me insist over and over on this. Having now 20% of spending in digitalization of society as one of the main objectives of the Recovery Fund is such a game changer. It's a lifetime opportunity. It's a generation opportunity to change the healthcare system of Europe. And by changing the healthcare system of Europe, we change the healthcare system of the world, of course.
Thank you very much, Roberto. Claire Berry from DG SANTE, from DG Health and Food Safety. On the role of digital health in cancer care, what is your opinion on that very important issue?
Thank you very much, Morten. It's a very important question, I think. So, as I mentioned earlier, what's happened during the pandemic has also acted as a catalyst in other areas in how we can use the digital tools, and I think that cancer's included in this. So, in the use of technologies like AI, big data analytics and robotics, we've seen how they've been used to support the healthcare response in the crisis, including pooling data and telemedicine. And these kinds of developments can also be helpful for cancer patients. Now, they're not always able to go into their doctor, so having the possibility to do a consultation at a distance is also very, very relevant for cancer care. And the potentially substantial, I think, key areas of the disease and across the care pathway. I think, as you probably know, Morten, but maybe others not. We are in the process of elaborating a cancer plan for Europe, which we've been consulting on and which should be adopted by the end of the year. And I think that as part of that cancer plan, digital technologies will recognise there that digital can be a game changer for cancer, because there'll be a number of measures in the digital area, including the use of AI, when we come forward with the Beating Cancer Plan for Europe.
Thank you very much.
Morten,
yeah,
if
Claire,
I
Roberto,
can,
would you like
on
yeah,
this
please.
question, to add what Claire was saying, I mean, when I mentioned the digital twin of our body, one of the main targets, of course, is to have a tool which will be, I mean, in terms of power, unprecedented, to understand better how our immune system works, to link genomics with the functioning of the body. And this is why, I mean, we now need to put all the pieces together. I mean, computing, artificial intelligence, data, genomics, because this will be something which is, in terms of giving to the research and the scientists and the doctors the ultimate weapons to fight the cancer, this will be really a breakthrough. And that's why, I mean, in the newly announced initiative that we have announced last week about supercomputing, this digital twin of the body will be a centerpiece.
Thank you very much, Roberto, for that part. That was indeed also the digital twin that you spoke about in your introductory remarks earlier. So thank you for that, for having expanded a bit on this. I'll take another question from Slido, from a participant called Alex. As digital health is interconnected to other domains, how hard is it to get together different stakeholders to share their experiences? Claire, I would like to ask you first on this one, so the stakeholder and how to get them together.
So I think, as I mentioned in the speech as well, this is something which has been very much at the forefront of what we've been concerned about, getting all the different stakeholders together. I think we don't necessarily have the same tradition here in Europe as we do at national level. So that's something that we have to work on. I think once we do get the stakeholders together, they see how beneficial it is to be learning about what's happening in other countries, and they're very ready at that point as well to share their knowledge and their information. I think in the European health data space, that's going to be one of our biggest challenges, which is making sure that we get let's say the public sector and the public hospitals, and also that we make sure that we have the necessary engagement from the private sector as well, because the private sector, of course, is driving research and the rollout of medicine to patients. Although we have to recognise sometimes that having the public and the private in the same room is not always so straightforward. But I think we really have to try and get that working here to make sure that the data space is going to be a success.
Thank you for that, Claire. Roberto, any perspective from your side and your DD side on the question of essentially trying to get different stakeholders together to share their experiences and the difficulties on occasion in this? Roberto, are you muted?
Morten, can you repeat the question?
Yes, absolutely. So it's the same as for Claire, from a participant called Alex, on the issue on how difficult it may be, how hard is it to get together different stakeholders to share their experiences. So not the commission and in the regulating part, but actually sort of a convener of conversations, how to get stakeholders together in the pursuit of this, and the difficulties that you see from your DD's perspective in getting stakeholders together.
No, it is difficult. I mean, because when speaking about healthcare, we speak about us and our society and everything which is around us. So there are many stakeholders that need to be factored in when you want to have an effective dialogue. And I think it cannot simply be that, I mean, by law you have to oblige, or you oblige stakeholders to come together. It's also through co-creation, it's also through cooperation that you can get there. That's why, for instance, things like sharing data among different stakeholders on a voluntary basis is so important. I mentioned this Pharma in a Box initiative, which we have in the repurposing platform called Escalate, to find an antiviral that works. We can imagine that this kind of cooperation becomes much more structural in the future. So a company which is active, for instance, in the area of mobility management can come together with companies acting in healthcare, or companies which are active in the area of well-being and building construction, coming together with actors which, for instance, research and have activities around respiratory diseases. These kind of cooperations, at the end of the day, are data cooperations. At the end of the day, it's getting the data together, agreeing in standards, agreeing on exchange. That's why, and I'm sorry for the marketing, so to say, pitch, that's the other leg of our data governance proposal. I already introduced one, which is about data donation and data philanthropy, one which is empowering users with personal data spaces. Another one was mentioned by the Commission, by the way, in the video, saying we need to reuse more and more scientific data. The fourth one is to make sure that you have actually the possibility to broker deals and having neutral actors that allow, I mean, different components of the society to come together and to cooperate. And again, this should be done without any gatekeeper. I mean, there should be a voluntary action by stakeholders, and there should be openness in those schemes. So this is another element that we would like to bring together when it comes to data governance and our legislative initiative about data governance.
Thank you very much, Roberto. There's a bit of a related question from a participant who is sitting in Eindhoven and is involved in creating smart health ecosystem there, with, amongst others, the municipality and other municipalities, I'm sure. So the question is, are there other initiatives that we could connect with? I guess you can also broaden the question a bit to speak a bit about our local and regional capacity for trying to reach out to stakeholders. Roberto first, and then Claire, please.
I'm very sorry, Morten, you have to repeat because your voice was cut many times.
I'm sorry for that, Roberto. There's a question from a colleague from a participant who's sitting in Eindhoven, who is asking, are there other participants in local initiatives that the colleague or the participant can engage with? So if you broaden the question a bit, Roberto, what is the local and regional dimension of our initiatives for smart health?
Well, I mean, we have a very, very vibrant community of healthcare, which it doesn't start from today or a few months ago, but it dates back in years. And we have been engaging in a number of initiatives which are, I think, well known and discoverable on the various websites. Also, we have this concept of digital innovation hubs, where we bring together, I mean, clusters of innovation, including in healthcare, coming from different expertises. With the Eindhoven cluster around the Technical University of Eindhoven, about, I mean, the companies that are working in the medical area, we have a very important cluster, by the way, of companies, universities, which are, and research institutions and startups, which are really working actively in the healthcare, and they do participate to our programs. This is a reflex that we want to maintain and enlarge with the Digital Europe program that Claire mentioned, and also, of course, I imagine will be the same in Health for EU. So again, in cooperation with DG SANTE, will make sure that we involve a stakeholder. With the recovery facility, of course, there will be a number of national initiatives which will be proposed, and we them further. As in the past and in the future, the use of regional funding can also be utilized.
Roberto, thank you very much. And to other participants following online, this might also be the good moment to remind you that you can follow different communities, including around digital health, on the Futurium website, which is one of the quite vibrant websites where participants and stakeholders go on different types of subjects. You can go in on Futurium, and this is also where you find all the sessions on Connect University, both the next sessions for the next days, but also all recorded sessions from the previous years on all sorts of topics on digital and on tech. We have only 3-4 minutes left. I will take the two most upvoted questions, one for Claire first, and then one for Roberto, and then we need to draw to a close, with apologies to those participants online whose questions we could not get to answer at this moment. We take the first one for Claire. What role for the Commission stimulating the deployment of digital health when uptake is strongly driven by national market access and reimbursement policies? Claire, please.
Thanks very much, Morten, and thanks for the question, which, of course, you're right that we're back into this question of what can be done at European level and what can be done at national level. I think, as I mentioned in relation to the EU for Health programme, where we hope there'll be a significant digital component, that what we were looking at there is that we'll be able to fund projects which will have a catalytic effect. So they will be projects which will be kind of lighthouse projects which will set an example and which then help with other uptake. But I think, I mean, obviously in something like the European health data space, it's clear that the Commission has to play a central role in terms of bringing all the different stakeholders together and setting up the European data space, and that we need European level rules for that, even though the funding for parts of that will still remain at national level. So the Commission there is using its convening powers. I think we were mentioning that, or Roberto was, in relation to how you get the stakeholders together. And I think that the convening power that the Commission has, even though we don't have significant powers in the health area, is shown very much by what's been done on vaccines, where we've managed to bring together the pharmaceutical companies, and we have a range now of vaccines or options on vaccines across a wide range of pharmaceutical companies. And we're doing that on behalf of all the member states, even though the money as such is going to partly come from member states and partly come from the SC budget that we have for which is the emergency support instrument. So I think we can use our convening power, we can use our financial power in a way that helps it act as a catalyst, and we can also come with our ideas, for example, on the European health data space, in terms of setting up this space and getting the member states to work together to get there.
Thank you very much, Claire. Claire Berry, from the Deputy Director General from DG SANTE, the Director General for Health and Food Safety in the European Commission. The last question is to you, Roberto Viola, the Director General for DG Connect in the European Commission. And it's from a participant representing industry, I would think. There's been quite a bit of also industry and SME participation in this online session. This question from Jorge Gonzalez is: overcoming the valley of death after successful innovation pilots. Would that be a priority for the coming years for the European Commission? The lack of adoption is killing us. Roberto, your perspective on this, and that would be the last question we managed to take today.
Thank you, and I will be short in answering this question. And when speaking of healthcare, there cannot be any death, no? And value of death. There can only be value of life. We have brought artificial intelligence into the operating theater in no time when it comes to COVID. But it was a struggle, because many European companies were not ready for it. I think it's a journey that we have to do together, the public side and the private side. I see too many shy people around, and I think now we cannot have the excuse the funds are not available. I mean, we cannot have the excuse, but the Commission is not focused on healthcare. Listen to the speech. If you have not done it live, now you can listen offline to our President. We are very focused. We have the resources. Now we need the courage. Thanks very much.
Roberto, Viola, thank you very much, and thank you very much to Claire Berry, and thank you also definitely to the Commissioner Thierry Breton, the Commissioner for the Internal Market, who opened today's session of the Autumn University for Connect University. And where this session has been streamed today, it is also possible to catch this in a recorded way online. We have a total of 11 sessions in the Connect University's autumn session. There was quite a number of participants asking, especially around the data side. So those participants may be interested in tuning in again on Wednesday, the 23rd of September at 2 o'clock, same place, same site, where we have a session, this session 4, on big data and digital health. We also earlier that morning have a session on high performance computing and health research. That is something that both Claire and Roberto were speaking about in their interventions earlier. And we also have, that is already tomorrow, a session on artificial intelligence meets the health sector. But the very next session is tomorrow morning at 10 o'clock on digital healthcare, which is one of the top priorities for the German health system. And with Germany also currently having the chair of the presidency of the European Council, this is a very timely session tomorrow. You can see online on the Futurium site the other 11 sessions in total. You can see which date that you should tune in and at which time you should tune in for the next elements of the Connect University's autumn session on digital and digital healthcare. I will leave it here. Thank you, first of all, our two main speakers, Roberto, Viola, and Claire Berry, but also all you participants online for having stayed with us throughout this session, for the dynamic action, for the questions that you have posed us on how to shape difficult questions on how to shape digital society. There will be these other sessions coming on. Please do tune in again. And as I said in the start, for those who are specifically interested, there will be a certificate available for following all the university sessions. If you follow 7 of them, you will get a certificate from this. So check out the site on Connect University. Thank you very much for following today, and I do believe and I do hope that you will come back and follow one or more of the next sessions. I will finish here. Thank you very much.
Thank you to you, Morten, for the excellent show.
You are the only participant.